We'll start. So, as far as your syllabus is concerned, next two drugs belongs to a group called as diuretics. So, these drugs acts in the renal system, kidney. So, before we directly jump onto that, I will just give a brief view of this, what is happening in the renal. You know the nephron, structural function unit of kidney, and this nephron has its own parts. What are the parts of nephron? Parts of nephron: glomerulus, Bowman capsule, proximal convoluted tubule, then thick descending leaf, thin descending leaf, loop of Henle, thin ascending, thick ascending, distal convoluted tubule, and collecting type. Right? And it also has efferent and efferent arteriole. And this is the glomerular capillaries. So when the blood flows through the renal system here, through the glomerular capillaries here, all the content of the plasma gets filtered and it goes back, except plasma proteins, albumin and globulin, that is not filtered. If this plasma protein comes in the urine, this is urine. If it comes in the urine, that means there is a kidney damage. Plasma protein should not come in the urine. If it is coming, means there is a renal damage, and patient will have swelling of the body. This plasma protein may come in the urine in case of acute glomerulonephritis, chronic glomerulonephritis, diabetes mellitus, or any other reason that is causing kidney damage, whatever it may be. Once all the content of the plasma comes, that is called as glomerular filtration. Once it is in the renal tubule, nephron, some of the content of the plasma, which is here, which is now it is formation of the urine, isn't it? So gets reabsorbed and some gets secreted. Because of the interplay between these transporters, finally the urine is formed and gets excreted. So that's what we have during urine formation: glomerular filtration, tubular secretion, tubular reabsorption. All these three will play in the formation of urine. So the main ion which decides the factor of blood pressure is your sodium, along with water in the plasma. The sodium concentration is more, even the water volume is more in the plasma, that increases the AP. And there are so many other factors where the ion and the water content get affected. We have the very sophisticated mechanism to control all this thing, that is your renal system. If body is swelling, so for one or other reason, that means the renal system is not functioning, and that is called as here edema. Whole body may get swell, or some part of the body may get swollen, depending on the condition. And sodium can be inside the renal tubule in the form of sodium bicarbonate, sodium chloride. Right. So this bicarbonate, what is the mechanism occurs in the renal tubule? Same thing occurs elsewhere in the body also. For example, in case of eye, this bicarbonate is needed for aqueous humor synthesis. The same bicarbonate is also plays a role in case of GIT, that is to neutralize the gastric acid. These are some of the mechanisms how sodium bicarbonate is formed, and also the sodium chloride that is in the renal tubule. Now, these diuretics are the drugs that increase the excision of water and electrolytes, mainly sodium and chloride, from the body by promoting urine formation in the kidneys. Remember, this is the definition of diuretics. Now, if you see the nephron, I'll write like this. This is a glomerulus, PCT, loop of Henle. This is your DCT and collecting duct. This is your glomerulus, proximal tubule, loop of Henle, thin ascending, thin descending, thin ascending. These are thick. So this is the DCT, that's the collecting duct. Now I am talking about, as per your syllabus, only 2 drugs we have to read, but the drugs that cause diuretics act at different site. Some drugs act in this site. Site number 1, that is in the PCT. Those drugs come under a classification called as carbonic anhydrase inhibitors. That is not there for you, but you know I am telling this point number 1. Site number 2, this part of the segment is permeable to water. Once the water crosses this segment, nowhere it gets absorbed, it has to go in the urine. But this is the only section where the water can get reabsorbed. It's a water permeable segment. So here, when a diuretic acts, that is called as osmotic diuretic. This is there for your syllabus. So this is site number 2. One more drug that is a very high efficacy. If you take that drug, lots of urine is passed. Patient may get dehydrated also. That is acting in the thick ascending link. And those drugs are called as loop diuretics or high efficacy diuretics. So you have this for your syllabus. Site number 3. Some drugs acts as a DCT to prevent the sodium reabsorption. They are called thiazide diuretics. This is not there for you. This is point number 4. And 2 drugs, class of drugs that can act at this level, collecting drug. They are called as potassium sparing diuretic. That is also not there for you. So point number 1, not there. 2 is there, 3 is there, and 4 and 5 is not there. For other courses, we are teaching all the diuretics subclasses. But for your syllabus only 2 are there. As per my calculation, you have to see, know all the things. It is a very interesting thing, but it will kill lots of time. So I am directly going to the what is the syllabus. So in time permits, we will see in future other parts. So as per the syllabus, we are going to first. They gave in your syllabus Lasix and mannitol. Remember, Lasix is not the generic name. It's available in the market as trade name. Lasix 40 mg tablet is there. Lasix ampule injection is there. If you give that, then patient will have dives. Lots of urine is passing, and the patient get rid of this hypertension, edema, so many other conditions the uses are tell you later. So generic name of Lasix is furosemide or also called as furosemide. This is generic name. In the exam, they may ask you directly furosemide or furosemide. The market is available as Lasix. Tablet is there, 40 mg. Injection also is there. Injection Lasix. Remember, in the exam, if they ask you Lasix, you write it is nothing but furosemide or furosemide. If they ask you furosemide or furosemide, you write it is available as Lasix. Okay, in the market. Now, which group it belongs? You can see Lasix is a trade name and generic name is furosemide or furosemide. So it is under drug class, as I told, loop diuretics or high efficacy diuretic because it is acting on the thick ascending limb. Why high efficacy means lots of body volume gets passed through the urine to bring down the blood pressure rapidly or to control the emergency condition rapidly. We are going to give Lasix or furosemide. It's a drug, it's an emergency drug. Now I am going to talk about this. I will tell later. We'll talk point number 3. Here is the drug acting. So when the sodium gets filtered, coming here, and once it comes to this segment, so this segment we enlarge and show here. Understood? So now this is the tube that contains urine. This is the cell and this is the blood. So once the urine is having sodium, potassium, 2-chloride, the sodium, potassium, 2-chloride, symporter. Symporter means all the ions are passing from one place to other place. Symporter means all is from one place to other. Antiporter means some will go, some will come back. Antiporter. The symporter operates and this will move. When this moves, here we have sodium, potassium, ATPase, and also you can see the chloride. This chloride goes from here and gets absorbed. Sodium comes in exchange with potassium. This is antiporter. So this sodium and chloride gets in the blood, and here we have increase in the blood volume and the concentration sodium chloride. Now you know sodium and chloride in the urine, how it got again back to the blood. Sodium also came, chloride also came. And one more thing is, once this potassium comes here in exchange with the sodium, the potassium comes inside the cell and it doesn't have any place to go. It again comes back to lumen in the urine. Actually what is happening here, before it comes here, you can see here, now the potassium is coming from here. Can you see this? And the potassium coming from here. Can you see this? Now intracellular potassium will increase. Now this potassium is not having any place to go out. So what it does, the potassium again gets exited because of the increase in the potassium, again get exited through the lumen. Now here the lumen positive potential will increase, and that's the driving force for absorption of calcium and magnesium. I am not written here. Calcium and magnesium through paracellular pathway. The pathway between the cells is called paracellular pathway. Through this pathway, the magnesium and calcium gets reabsorbed. Remember this point. I am not showing you this diagram. I am just telling you. I repeat again. Sodium, potassium, 2-chloride get reabsorbed. Sodium is coming in exchange with the potassium, and chloride is coming through other chloride transporter. Sodium chloride already is got trapped there. It's in the blood vessel again. The potassium which came from the blood side and the potassium which came from the urine side, they get accumulated inside the cell, and lumen, potassium, first the cellular potassium level increase and there is no other place to go. The potassium get exited through the potassium channel and comes to the lumen. So because of this lumen positive potential, because potassium is positive ion, positive potential increases. Because of this, there is a reabsorption of calcium and magnesium. Now I know body's maximum sodium gets reabsorbed in this segment. About 60 to 70% sodium get absorbed in this segment, thick ascending limb. And if a patient has high blood pressure or body edema or anything related to sodium, hyperaldosteronism, whatever it may be, if the body's sodium content is more here, you don't want the body again to reabsorb more sodium, isn't it? Already sodium concentration more here. That is contributing for BP, edema, etc., etc., etc. And you don't want further sodium to get reabsorbed. What you do, you give a drug called as loop diuretics. The loop diuretics will go and inhibit this sodium, potassium, 2-chloride symporter. When you inhibit this, sodium is not reabsorbed, potassium is not reabsorbed, chloride is not reabsorbed. Because of this, this will not operate, and that is also not operate. So here there is no sodium chloride. So body sodium level drops. BP comes under control, edema comes under control, because it's not getting reabsorbed, it's going in the urine, and patient is getting better and better. And because potassium also does not come here, even the potassium does not come here, there is no positive potential here, and there is no positive potential here also. So because of this, the magnesium and calcium gets out from the urine. Others got absorbed. Because you inhibited this, even the calcium and magnesium is going in the urine. Remember this part, I'll tell the factor later. When it goes in the urine, what happens, I'll tell later. So we got main points here. Inhibit this transporter. Here only we block the pathway, whole pathway got blocked here. So our purpose is served to prevent the absorption of sodium. Okay. Same thing I just showed in a different view. You can see a sodium, potassium, chloride is there. The sodium is coming here, sodium we got here. And the chloride comes with the chloride channel. So we have got sodium, chloride here. And this sodium, when it comes here, potassium is again coming back to the cell, and the potassium has to go over here. See this cycle? How it is doing? Comes, again goes, comes. So whenever it rotates like this, it is passing this sodium chloride inside, and sodium is coming in. So whatever the sodium chloride is in the urine here, it will come back here. So because of that, I give furosemide and inhibited here, and here whole pathway is blocked. Understood? Now this is what I mean. Microscope salt reabsorption, the thick resin glucophenol in the site of action furosemide. So in the exam you would write either previous diagram or this diagram. So just you write like this in the exam. Right, like this. Here lumen, tubular cell, interstitial blood. Here write like this: sodium, potassium, 2 chloride, zinc water. So this you write like this towards the blood. And here you write one chloride channel. So here you write potassium. The sodium goes here, potassium comes back here. And chloride comes here. So sodium chloride again got back here. Potassium is coming here, because potassium is coming here, increases, again it has to come back and push this magnesium and calcium towards here. So, sorry, these are not opposite. Let's push this calcium magnesium, it has to come back here and push the calcium magnesium back to the blood. So we gave loop diuretics that inhibit this, and whole pathways got blocked. Right. Now, what is happening here? How to write in the examination? Write in the flow chart. Furosemide or furosemide inhibit sodium, potassium, 2 chloride co-transporter, zinc water in the thick acidic limb of nephron. Inhibit the reabsorption of sodium, potassium, 2 chloride, and also water. Water also gets excited. Diuretic effect. That's one issue. This is enough. Even if you don't write diagram also, I don't mind. You write this much is enough. General uses: edema due to congestive heart failure. More and more body volume is getting increased in the blood. You want to remove excess of fluid from the blood. You give this edema comes from liver cirrhosis. You can use this renal disease and pulmonary edema. For pulmonary edema, patient cannot be able to breathe properly. Full breathlessness. The drug of choice is furosemide. Rapidly release the pulmonary pressure. Before diuretic effect takes place, it relieves the pulmonary pressure. So drug of choice for pulmonary edema and edema is your furosemide. Emergency use. Already told. Acute pulmonary edema means immediately if there is any edema in the pulmonary vessels or in the pulmonary area, it will reduce the edema. It is an emergency drug. Hypertensive crisis. Patient got increase in blood pressure. We have two important emergency situation. I don't know whether you want to study in your pharmacology. Hypertensive urgency, hypertensive emergency. Hypertensive urgency, emergency. In this case, the BP is more than 180 by 100. Here also more than 180 by 100. Both are same. But what is urgency means there is no evidence of end organ damage. That means the retinal damage renal damage, nothing is there, but only BP is showing more than 180/100. In this case, there is evidence of end organ damage. Renal damage is there, retina, or even there is a cerebrovascular accident. So if there is evidence of end organ damage, so this is called as hypertension emergencies or crisis. That case also, to rapidly reduce the pressure inside the blood vessels, you can use this drug. And hypercalcemia, you tell me, there is an increase in the calcium level in the plasma. Can you use diuretics?
Yes.
How? You know the mechanism, tell me. Now, there is some other condition where the blood plasma calcium level is too much increased. I don't want again calcium back to the blood. If I use diuretics, what happens? So we already told, if you are not using the diuretics, the calcium magnesium would have got reabsorbed. Because you inhibit the transporter, the calcium magnesium is not getting reabsorbed, it is going in the urine. So if in the body, if the calcium level increases, you get diuretics to remove excess of calcium. These are other uses. But actually, if a patient is not having increased calcium, remember this, if the patient is not having normal calcium level is there, use diuretics, the patient will have hypocalcemia because much of the calcium is not reabsorbed. Normal calcium is not getting reabsorbed. You will have hypocalcemia, you may have some bone weakness and etc. If the patient really has high calcium, you can prevent reabsorption. For example, if the patient has calcium stone, this is because of more calcium reabsorption. Use diuretics, okay, but it's not having calcium stone. Calcium is normal. When you use diuretics for hypertension, the adverse effect is hypocalcemia. Not only that, one more hypo is there. What is that? This is okay. Calcium level. One more? Correct. What is that? Not killing me. That I will tell later. One more is there. Magnesium. Mg2, because this is also not reabsorbed. So hypocalcemia, hypomagnesemia. So this is adding for what? Adverse effect. So what is adverse effects of this? Aram se now you can tell. Because I know its action, I know its adverse effects also. And as you told, hypokalemia. Why hypokalemia occurs? So I will tell it after telling the uses. So you remember this emergency use, PER, pulmonary edema due to CHF, liver failure, renal condition, emergency hypertension, raised calcium. And all these are emergency use of your loop diuretics. Dose and route. I am not going to explain this. You can read it. Here we told the condition with the dose and route. Here route is mentioned here. Okay. So I'm not going to explain that. You can just. But there is no other way. You have to by heart or frequent reading. Nothing else to explain there. Come to adverse effects. Fluid and electrolyte loss or imbalance because you want to play with the ions, isn't it? Then uric acid will increase and that may precipitate a condition called as gout. The uric acid crystal can get accumulated in the joints and produce pain. Renal dysfunction can be possible because more of volume is going out through the urine. The patient may get dehydrated and renal dysfunction can be possible. And if you use little in higher dose and all, it may cause rapid fall in the blood pressure. It causes low BP, hypertension. You keep on checking the blood pressure. Ototoxicity, very very important. It may cause the ear damage, ear organ damage, especially with the IV and high doses. Ototoxicity. Orthostatic hypotension means the patient taken the drug and suddenly stands because the blood is rapidly pulling down towards the gravity. He may fall. That is called as orthostatic hypotension or postural hypotension. Postural hypotension. So that's why we tell the patient, whenever you take the drug, you don't get up and go for washroom. You go to washroom, come take the drug and sleep. After taking the drug, you got up, went to washroom, you fell there and you got fracture. Because it's also sometimes we have one more term called as first dose hypotension. The moment you take first dose, first time the body is getting exposed to the drug, and he suddenly got up because the venodilation, the blood is rapidly pulling down to the gravity. So the blood flow to the brain gets reduced, and he may fall giddiness and he may. So because of that, you should be very careful whenever you do this. So postural hypotension is caused by, one is your loop diuretics, furosemide. One more drug causes postural hypotension, first dose hypotension is your prazosin. It's alpha blocker. One more drug that causes your AC inhibitors. These are the drugs used in hypertension, but they cause vasodilation and they may cause sudden hypotension. So this is also one of the drugs that cause obviously cause postural hypertension. And photosensitivity and pancreatitis. This is nothing but allergic reaction. Last time I told you, any drug that comes under sulfa group, they all cause allergic reaction. So they also have this sulfa moiety. Contraindication. Now I told before. Hypokalemia, why it causes it? I didn't mention the others, you can add it there. Okay. Now you use the drug. The drug is inhibiting here, furosemide, in the thick assembly. So the sodium came here, getting filtered here. We could have absorbed from here, but you inhibited. The sodium is coming here. Sodium came here. Okay. Now the body senses somebody has given the drug and try to inhibit the sodium reabsorption. So body wants to reabsorb sodium. So what it does, it's going to stimulate your adrenal cortex. You have done adrenal cortex. Remember the adrenal gland? So in this there is a release of mineralocorticoid or aldosterone. Aldosterone will come and act in the collecting duct and it wants to reabsorb the sodium what you inhibited here. When more and more sodium is reabsorbed, more and more potassium gets excreted from the blood to the lumen and the potassium goes out to the lumen and this causes hypokalemia. So hypokalemia will lead to arrhythmia, heartbeat and rhythm gets lost. So that's why whenever we use either furosemide or the thiazide diuretics, we use along with one more diuretic called as potassium sparing diuretic. So that potassium sparing diuretic is acting at this level. So you block the sodium reabsorption here also, you block the action of aldosterone here also. So the sodium will not get reabsorbed, goes in the urine. So whenever you use furosemide or the thiazide diuretics, it may cause hypokalemia. To prevent hypokalemia, you have to use with potassium sparing diuretic. The drug names are just mentioned. We have two groups are there. One is called as aldosterone antagonist and sodium channel blocker. Two groups are there. Aldosterone antagonist, the drug name is spironolactone. Spironolactone. This is an amyloid and triamterene, triamterene. Spironolactone, amyloid and triamterene. But both these are potassium sparing diuretic. So whenever you use either furosemide or thiazide diuretics, you have to use either with this or with this to prevent the potassium loss. Remember that. That's just you have to mention it, that's all. What is the contraindication? Because kidney is completely failed. If we use the drug is acting in the renal system and the kidney is not functioning, if you use the drug, it's waste. If kidney is functioning only, you can use the drug. If kidney is completely failed, if you use the diuretics, if not where it will go and act, it is failed. Just don't use it. Then allergic to sulfatase, already I told you. If he has a history of that, and imbalance of electrolytes, severe it is there, don't use. Then liver or hepatic coma, hepatic encephalopathy, there also you should not use this diuretics. Precaution, we are very careful in case of elderly because it causes massive dehydration and orthostatic hypotension. Elderly are susceptible for that. Diabetes can cause hyperglycemia, so keep a watch on the blood sugar level. Gout patient, as I told you, it will increase the blood urate level. So gout patient, you have history is there, very careful. Digoxin users, because low potassium level will increase the digoxin toxicity. Digoxin is used for congestive heart failure because it increases the force of contraction of the heart. Diuretics are also used in congestive heart failure. But whenever you are using together, you make sure that potassium level is monitored. And that's why we told precaution. We didn't do contraindication, because both deoxygen loop diuretics are used in congested heart failure, but have a check on potassium level frequently. And hearing impairment already causes ototoxicity. So a patient already has that history, or if it's an elderly patient, or either avoid, go for alternate drug, or else keep a watch on that. Now come to next drug on the diuretics is your mannitol. Mannitol is a drug that is acting in the site number 2. What I told. What is the site number 2 there? It is in the thin descending limb where the water was getting reabsorbed. That's the only place where the water gets reabsorbed. Then it is in the vein tubule. All other segment of the nephron is water impermeable. Only that small segment of the nephron is water permeable. Where the see, there are two pathways where the water can reabsorb. One is passive reabsorption, one is active reabsorption. So when I told like this, DCT, only this part I told what is getting reabsorbed in this part. So when the water is filter is coming here, so this one place where the water can get reabsorbed. Once the water passes this segment, there is no way water can be reabsorbed. Up to here it can come. But here, the water can get reabsorbed actively by your aldosterone mechanism. It is going to produce some aquaporin channels once it is activated, and from here water can get reabsorbed actively. Only if this produces acts here. Otherwise, it is going in the urine. Now, if we give mannitol comes under a classification of diuretics called as osmotic diuretic. Furosemide was coming under what? Loop diuretic. And this is coming under osmotic diuretic. This is osmotic diuretic. What it does? Suppose if we give, usually mannitol we always give intravenous. If you give orally, it will not get absorbed, and it causes it comes out in the fecal matter, but it causes osmotic diarrhea. What it does is it draws the water wherever it is there. Suppose if this mannitol is there here, the water will draw inside this classroom, prevent the water reabsorption back. So this water is filled in the classroom. Similarly, so wherever this drug is there, it is drawing the water. So that's why if you give orally, it goes inside the colon and draws the water, and the fecal matter will be mixed with water and cause diarrhea. Suppose if you give intravenously mannitol, the mannitol, once it comes inside the renal tubule here, it gets filtered, neither reabsorbed nor secreted, only filtered. Remember this. Mannitol gets filtered in the renal tubule, neither secreted nor reabsorbed. Once it is there inside this renal tubule, it is passing. Once it passes through this segment, it exerts osmotic pressure. The pressure creates to draw the fluid inside the tubule. So whole tubule is filled with your osmotic diuretic, that is mannitol. So when it comes here, prevents the water. Once the water crosses here, it has to go out. The water has to go out. So mannitol gets filtered, neither secreted nor reabsorbed, exert osmotic pressure in the renal tubules, especially water permeable segment of the nephron, prevents water absorption from the renal tubules, especially proximal tubule and descending loop of Henle. Also draws the fluid from tissue to circulation. Which tissue? Peripheral tissues are there now. To circulation. Once it comes to circulation, the blood has to come here, and the drug has to come here, and what is? So I am talking always about water. I didn't use any word there, sodium, potassium, nothing I used. So whenever is mannitol, more water goes out of the body. Sodium is not touching, it's not touching the sodium. So we can also call this as water diuresis. Now for example, you tell me, there are sodium, we talk in terms of number, 50 sodium is there and H2O 50 is there. For example, okay, both are balanced. 50 sodium, 50 water balance. Now I made more water go out. Water is 10, which is inside the body. Now it become 10. Sodium is same inside the body. Which is more here? Hypernatremia. Compared to that water, sodium level in the body is more now. 40 went out in the urine water, 10 is there inside, and sodium level is same. So compared to that water, sodium is more. Is hypernatremia adverse effects. Understood how you are going to learn the pharmacology also? What is systemic effect? As I already told, it draws the fluid from brain, eye to the system circulation. So anywhere inside the body, the tissue edema is there. You can reduce edema by using this mannitol. It draws the fluid from the tissue to circulation. Once you have to circulation, the circulation passing through the renal system. From the renal system, the water is going out. The edema comes to cerebral edema or glaucoma. In all those things we use, enters the system, diuretic effect, decrease intracranial pressure and decrease intraocular pressure. So inside the brain, the pressure gets decreased because you draw the fluid from the brain tissue, and a condition called as glaucoma. You go and learn what is glaucoma. Intraocular pressure increase due to increase in aqueous humor. In that case also we can use mannitol to rapidly reduce the intraocular pressure. If you don't reduce the intraocular pressure in glaucoma, patient can become blind. Glaucoma is a separate topic, so that is the way on very detail. So what is it? Generation of mannitol promote diuresis in acute renal failure. What is acute renal failure? Now the nephron failed to hold the water, or is getting dried up. In simple language, water content is not there, getting dried up. You use mannitol, it retains the water here, so prevents the dryness, right? So in case of acute renal failure, use the mannitol so that it can retain the water inside the tubule and tubule can leave. There is no dehydration inside that. Then in case of rise internal pressure, we can use this already. Acute glaucoma, cerebral edema, brain trauma, we can use this. And to rapidly eliminate the toxin, we can use this. Suppose toxin is there in the blood, you want this toxin to go rapidly out of the renal, use mannitol. It tries to rapidly excrete this toxin. This is also called as forced diuresis. The poison remains long time in the body, cause more harm. You make it excrete more faster using this mannitol. This is the dose. I give only IVC. Orally it gives what happens? Hospital diarrhea. But we never give orally. What is intravenously? Intravenously only, no IM also. If you get IM, where it goes? Once it goes muscle, it will not go to circulation at all because it's a big molecule. It has to be in the blood vessel and it has to get filtered in the renal tubules. Neither second nor reabsorbed. It has to be given IV only. No other routes for mannitol. So hopeful is the adverse effects. What is hopeful? Hypovolemia, volume of the blood gets reduced. Hypertension, overhydration rarely causes pulmonary edema because it is drawing the fluid from tissue to blood. So blood volume initially increases, then it gets decreased when it comes to renal system. Before that, it may aggravate the pulmonary edema. Then precipitation of heart failure, electrolyte imbalance because sodium level increases, they told. Then fluid shifts, headache, nausea, etc. Urticaria and local irritation, injection site can occur. Okay. Contraindication: don't give congestive heart failure, hypovolemia, severe dehydration. If kidneys don't produce urine, don't give this. Because kidney failure is there. Filter only is not occurring. If you give the drug, it will just remain in the blood vessel. It will not come to kidney filters only, it has come to nephron. The filtering capacity is lost now. And if you give the drug will remain in the blood vessel, drawing the fluid inside the blood vessel, and the blood vessel volume is increasing, but the drug is not going out. Danger. Then pulmonary edema or active intracranial bleeding is there if you not use this mannitol. Precaution should be there in renal impairment, respiratory disturbance, cardiac pulmonary condition, use of IV mannitol. So use a filter needle as crystals can form in solution. This is precaution. So this you want to learn later. And these are the precautions for this use of mannitol contraindications. Where and all you are doing contraindication precautions. Now with this, we finished diuretics. That's all. So as per your syllabus, we have only two drugs. One is Lasix, furosemide, and second is mannitol. Why they are given only those two drugs? Because they are the one which is used in emergency. Furosemide is an emergency drug to rapidly control hypertension and to reduce the intraocular pressure, intracranial pressure. Immediately, we use mannitol. Because these two are emergency drugs, they gave these two drugs. Whereas carbonic catalysis inhibitor, there is also used in glaucoma, but not like an emergency. And thiazide diuretic, even aldosterone and all, not much used in emergency compared to these two drugs. That's why they gave these two drugs. You know, we have one more small topic is there. You know, how many slides are remaining? It will be over. Antihistamine. The next group is antihistamine. You know what is the definition of histamine? Hista means tissue. Hista or histo, tissue. Amine, tissue amine is histamine. Histology, you heard this? Study of tissue. So the tissues produce this chemical substance which is in the amine form, histamine or tissue amine. Now they are also coming under one more class, we can keep it, what is autocoids, A-U-T-A-C-O-I-D-S, autocoids. Autocoids are chemical substances that is produced by the cell on stimulation. They act on the same cell or act on the neighboring cells. Unlike hormone, they are produced somewhere and acting somewhere by passing in the blood. Whereas these autocoids, auto means self, autocoids, they are produced by the cell, act on the same cell or on the neighboring cells. That's what they are called as autocoids. So we have lots of autocoids. Among the histamine is also coming under autocoids. Other autocoids are prostaglandin, bradykinin, kallikrein, all these other autocoids. But as we are dealing with only with histamine, we stick on to this. Now I told histamine, but the topic is antihistamine. That means you are antagonizing the action of histamine. Why you want to antagonize? What is the reason? We'll see here. In your syllabus they gave us Avil. Avil also is not the generic name. It is a trade name. You write in the prescription RX tablet Avil, then the medical store person will give. If you write the generic name, some medical store will give, some medical store, if some other persons are working who don't have knowledge of generic name, they don't give what's a drug, they don't know what's a drug. Nowadays in Janaushadhi, they know generic name. Avil is a trade name, company given name. What is the generic name? It is phenyramine maleate. Avil contains phenyramine maleate. Like your Lasix contain what? Furosemide. Avil contain phenyramine maleate. It is a first generation antihistamine. Now you may ask some of the drugs you get in pharmacology, first generation, second generation, third generation, fourth generation. What is the meaning of first generation? Suppose if the drug, some few drugs are released to the market between, just for example, 1970 to 1980. So the drug released in that group between these 10 years, they come under first generation. Now 1980 to 1990, with lots of research, with good profile, less adverse effects, good efficacy, if they release the drug belonging to the same group, but they become second generation. They have more advantage. Suppose 1992 like 2000 or 2020, maybe the 20, the third generation. So generation is nothing but the drug released to the market with better efficacy and safety profile. So this was the first released. Phenyramine is a first generation antihistamine. Now what it does? First you see what is the function of histamine, how it produces. Histamine is synthesized in the mast cell, basophils, enterochromatin-like cells in the stomach and neurons. These are the sites where the histamine is produced. So levohistidine by enzyme histidine decarboxylase that removes the carbon dioxide. The enzyme requires vitamin B6, prototyl phosphate from L-citrate. There is a form of histamine. This is how it gets synthesized in the body. In all these cells, this is the pathway how the histamine gets synthesized and released. Once it comes out, what it does? It acts on these receptors H1, H2, H3, H4. For your syllabus purpose, only these two are important. This is not important. H1 is important because histamine act on H1. It causes allergy and inflammation, edema, urticaria, bronchospasm, etc. In case of you got some allergy, something is bitten, or you had some food and you got full rashes and all, you have to block the receptor. Then these two will get stopped. H2, if it is stimulated, increasing gastric secretion. If you block this, decreasing gastric secretion, H2 blockers. So that can be used in gastritis. But these two are not going to detail. Just you know there are other two receptors, H3 and H4. For the time being, is not important. So now, if you want to prevent allergic reaction, immediately or allergic reaction, you have to take one tablet. Which one you will take? You had something outside and you got allergic reaction. You want to take one drug anti-allergic. Which one you will take? Don't tell me. In this, what you want to block? H1. So H1, first generation. You don't tell Avil. You should not tell Avil. Avil is for general people purpose. You should tell always Phenramine maleate. It will remain here. Avil, even anybody will tell if they know. This signal you know how it's signal, what is acting. So now you come under drugs blocking histamine receptor are called as antihistamines. That's all. You block and you get the action. So first generation acts on H1, blocks actually phenol malate. One more drug is there. There are lots of other drugs are there, but I can only two drugs is enough because once you go to first generation, first gen. See, one adversity is there for this. You block the H1 receptor in the peripheral tissue and it reduces allergy, urticaria, rashes, all the things cause reduction, isn't it? With the same drug can block H1 receptor in the hypothalamus. When it blocks there, you feel drowsiness and sedation. So based on that, we have further three classifications: mild sedative, moderate sedative, highly sedative. Some will cause little drowsiness, some will cause moderate, and some will cause high sedative. Once you take it, you may sleep for 6 to 8 hours. And this phenol malate is coming under highly sedative. Patient is admitted in the hospital because allergy. You give this, he is just sleeping for 6 to 8 hours. We have one more diphenhydramine. Whereas second generation, we have, you heard this drug, cetirizine or cetirizine, this comes second generation. Loratadine, this was nowadays, lots of people are practicing loratadine. They are also using seasonal allergy. I will tell the advantage of these two later. H2 blockers, we are not studying this because we are going to study GA. Gastroesophageal reflux disease, peptic ulcer, etc. because they are going to reduce gastric secretion. Ranitidine, famotidine, they are coming under H2 blocker, is coming under GAT system. Here we are talking only about the allergy. Okay, so we stick on to only because as they are given Avil Phenramine, we stick on to the. You can see it.
What is the difference between allergy and seasonal allergy?
Seasonal allergy now in the season. You are getting allergy in this season. Allergy means whether season is there or not, you are getting allergy. You got ate prawn, you got allergy, you got exposed to dust. Seasonal comes only in the season, maybe in monsoon or in cold season. That's seasonal. Okay. Now, what is the uses of this phenol malate? PHA, RMA, pharma, pruritus, itching, any cause that is causing itching. Hay fever, allergic rhinitis, nose block, sneezing, anaphylaxis. There are also lots of histamine get released, cause extreme bronchospasm, allergy, or you took penicillin. Then running nose and sneeze. All your cough syrups also contain this phenol malate. That's why you drink cough syrup, you get sleepy. Motion sickness because it blocks H1 receptor in the vestibular apparatus. So you are traveling bus, you feel nausea, vomiting. If you go to gut section, you can take this and sleep around. Put headphone, take Avil and sleep. That's all. Okay. The allergy skin condition. Lots of dermatologists practice this. Whenever they go with allergy, they first start with this drug, but they tell you don't go outside, take rest. Because if you will be disoriented, sedation, drowsiness. These precautions. Now I told you what is the difference between first and second generation. First generation crosses significantly the blood-brain barrier, and that's why they cause sedation. This will poorly cross blood-brain barrier. This will not cause sedation, but has anti-allergic effect. So this is safer. That's why we always tell you go and take cetirizine. If you take cetirizine, you can go to college or work and all because you don't get sleepiness. But if you're in hospital, better to give this. Let him take rest. What he has to do if you're watching mobile, let him take a sleep. Serious filtration is crosses blood-brain barrier, does not cross. And example, I gave this to you. That's mainly it is about the first generation sleepy, act centrally. Second generation selective and safe and does not cause sedation and drowsiness. That's the difference. So which is the safer, cetirizine or phenylmalate? Cetirizine. Phenylmalate is a good drug, but use it in hospital or patient already in bedridden, staying in home, want to take rest or has a loss of sleep, and you can use this. Okay. So I have given the dose and route, injection, Avil, tablet is also available, strength, dose, route, frequency. Emergency use, sometimes blood transfusion can occur causing allergy, use this. Insect bite and stings, drug allergy, supplementary anaphylaxis. Anywhere, any allergy related, use this Avil or phenylmalate. Adverse effects, already we told. This is only most commonly telling for first generation. Sleepiness, drowsiness, low BP, eye blurriness, excessive dry mouth, palpitation, yawning should be there, dizziness. This all is the adverse effect. Come to contraindication, don't be in case of glaucoma, asthma, or some people may have drug allergy to this also. Take a history and do. There are few people can show allergy to even anti-allergic drug. Prostatic hypertrophy, where there is swelling or enlargement of the prostate gland. Precautions, as I told, once the patient has taken the don't allow him to drink alcohol or use another drug that was serious depression. Already is causing drowsiness. He has taken consume alcohol, he may go for like coma. Then activity alertness. He is driver and he may again. He made accident. Feeding, pregnancy lactation, because mother is taking Avil and baby is taking continuously because it is coming through breast milk to the baby. One of the root of the system. Elderly patients also they may feel drowsiness and sleepy and they may get fall. So make sure they sit, take the tablet, sleep, but after taking, let them not walk. This is a precaution. So with that, we are going to wind up today's class.